People with Down syndrome in most parts of Africa face stigma, isolation, and poor health care. It's one of the most misunderstood disabilities in the developing world. In Ethiopia, one family has moved to clear such misperceptions by helping launch the country's first foundation to support families with persons having the conditions. CGTN's Coletta Wanjohi reports from Addis Ababa.
Deborah was born in 2008 with Down syndrome. Her parents say giving her specialized care was costly, triggering a sense of despair.
When we took Deborah, she passed through surgery 2 times, and she stayed in ICU for 6 months by oxygen and others. It is very difficult for the family, for the mother, especially for mother, very difficult. After that, they have to have therapy. There is no therapy here, but need strong support. It's very difficult for the family.
Dr. Salaminesh Sige, who works at the Tikur Ambessa Hospital in Addis Ababa, says at least 250 cases of Down syndrome are seen at the hospital every month.
Most of the time we find these children in the hospitals if they have associated impairments. For example, if they have associated cardiac abnormality, or if they cannot breathe, if they have any respiratory abnormality, then the parents are afraid of losing their child and they bring them to the hospital. Otherwise, for a child with Down syndrome but no other organ abnormalities, nobody is concerned about the intellectual disability.
So far, there has been a distinct lack of specialized care. The Deborah Foundation was set up by the family of Deborah, the girl who has Down syndrome. The organization, named after that girl, has inspired the government to look at ways of increasing support for people with the condition.
What we are planning in the long term from advocacy and awareness task force is, to create awareness among the societies and to bring these kids from where they are just hiding now in different parts of the community, to make them at forefront, so that we can use them as a productive society, like what others are doing or contributing into the society.
For now, it is training experts who will then offer care and formal education to children with Down syndrome once this education complex is completed in a year's time.
Once this is done, the school is going to house children both with Down syndrome, but also normally developing children. Because here at Deborah, we feel like it's really important to have an inclusive classroom so that children grow up feeling part of their community and feeling normal, because that's what they are.
The biggest task for the country, however, is to fight the stigma that families with children with Down syndrome often face. South Africa is one of the few countries in the continent with a clear strategy of handling Down syndrome. In many other parts of the continent, children with Down syndrome fail to get relevant medical care, partly because the condition, like many other mental disabilities, is associated with cultural beliefs like bad luck. Here in Ethiopia, Deborah's family hopes their story will inspire others to learn about Down syndrome and get rid of the stereotypes. Coletta Wanjohi, CGTN, Addis Ababa, Ethiopia.